Eating these fats has been linked to up to a 64% reduction in risk for Alzheimer's disease in a specific cohort that was supplementing with this fat. But what does the research actually tell us about omega-3 fatty acids and brain health? Today we're going to break it down. I'm Dr. Austin Perlmutter. If you care about your brain, make sure you're following this channel. Omega-3 fatty acids are a form of polyunsaturated fatty acids that are characterized by having a double bond at the third position, hence omega-3. Omega-3 fatty acids, of which there are many, have been studied for their role in brain health. The most important of the omega-3s, however, seem to be docosahexaenoic acid, or DHA, and eicosapentaenoic acid, or EPA. And research has shown that we want to be consuming roughly 500 milligrams of those two fatty acids each day, which is equivalent to eating fatty fish 2 to 3 times a week. However, most American adults, and we're talking about 90+%, and yes, this is relevant to you wherever you live in the world, are not consuming enough of these fats. Now, why does it matter for brain health? EPA in particular is linked to regulation of inflammation, while DHA is a key component of our neurons, and higher levels of DHA seem to be protective against certain aspects of brain issues. So, what does the research tell us about consumption of these molecules and brain health issues? Multiple studies have examined this over the last few years. And what the research overall would indicate is number one, that eating fish is a good bet for brain health. I know there are corollaries to this. Some people have concern about heavy metals and other additional variables, but generally speaking, eating more fish is a good bet for brain health. If you don't want to eat fish, there are other ways to get these omegas. We'll talk about those things in a moment. As it relates to supplementation, there have been data on both sides of the spectrum, but a recent analysis did find benefit from supplementation long term with omega 3 fatty acids as it related to improved cognition. Now, I mentioned a statistic early on, which was this 64% reduction in risk of Alzheimer's. That was from a study that was published in the American Journal of Clinical Nutrition in 2023, looking at a subset of people that had supplementation with omega 3 fats and showed lower rates of Alzheimer's disease. However, at a population level, we don't necessarily see super strong signals with supplementation. Rather, what we see is that people who consume a diet rich in omega 3 fatty acids, including fish, as well as generally a Mediterranean pattern diet, these are the people who have the biggest benefit to brain health. So let's go back to the central premise of this, which is that most people are not consuming enough of these fatty acids. If that is you, well, one way to find out is to test. You can do a blood test to see what your levels of omega-3 fatty acids are. But if you're not eating seafood regularly and if you're not taking an omega-3 supplement, it's safe to say you're probably not eating enough EPA and DHA. So, what do you do about this? If you have access to testing, I think that is a good idea. If you don't, try to consume a couple meals of fatty fish each week. Good opportunities here: anchovies, sardines, mackerel, salmon, which is one of my favorite. These are great ways to get these omega-3 fats. What about if you're a vegan or if you don't like to eat fish? Well, that's where I think supplementation is something to consider. And ideally, you are working with your healthcare practitioner to figure out how much you need each day. But again, most guidelines would say you're shooting for around 500 milligrams at a minimum of EPA and DHA each day to support brain health. This is obviously a complex topic. If you'd like to hear more about it, please let me know in the comments. I'm Dr. Austin Perlmutter, and please follow me if you like this. I'll talk to you again soon.